the most commonly diagnosed cancers for men and women is colon cancer. And like other cancers, early detection and treatment is key to survival.
Stool study looking for materials that are shed from a colon cancer. The other one is colonoscopy.
Dan Goot says he tried to ignore his uncomfortable symptoms, not realizing how serious they could be.
One of the most deadly diseases in the modern world is bowel cancer. It is the second most deadly kind of cancer and the third most frequently diagnosed. However, the tremendous business that has grown up around this condition, one that is motivated by money, deceptive advertisements, and so much conflicting information that it leaves both patients and medical professionals confused and frequently incorrect, is what makes the fight against it even harder. What signs and symptoms appear early in bowel cancer? Which signs point to the disease's advanced stages? Stick to the end of the video to find out. Symptom number 1, exhaustion and fatigue. It's a longer-lasting lethargy that lasts for 2 weeks or a month, rather than only weariness and sleepiness from poor sleep. This weariness may be the result of concealed anemia in colon cancer. You could develop anemia due to the tumor's sluggish bleeding, so you must make sure you eat healthily. Colorectal cancer is one of the primary causes of anemia that has no apparent etiology. Cancer cells must divide quickly, which means they require a lot of energy. In addition to depleting your nutrients, this might make you feel exhausted and drained all the time. Thus, pay attention to this symptom. Symptom number 2, blood in the stool. For this reason, it's critical to monitor your stools and hold off on flushing them. Which type of bleeding ought to worry you? The rectum and anus are located after the division of the large intestine into the ascending transverse, descending, and sigmoid colons. One of the abnormalities of the right side of the colon is that it is bigger and produces watery stools, since the colon's job is to absorb the water mixed with the feces. Therefore, we typically don't experience any blockage symptoms if the tumor is located on the right side of the ascending colon. Anemia may cause the tumor to bleed more, or your stools may turn black like tar and smell awful, a condition known as melena. The sigmoid colon and the descending colon are smaller, and the stools are more pronounced on the left side. After having a bowel movement, or even after wiping it with toilet paper, there may be bright bleeding that falls into the toilet. Of course, there are other possible causes, such as hemorrhoids, anal fissures, or even eating beets and experiencing crimson stools, but it's crucial to rule out anything more serious. You cannot assume that bleeding is merely a result of hemorrhoids. There are many levels of bleeding, ranging from tiny quantities of blood in the stool to severe bleeding. And why would it result in feces containing blood? The tumor may have ulcerated, a blood vessel feeding the tumor may have bled, a gastrointestinal wound may have occurred, or you may have pressed so hard that the pressure on the intestine wall increased and you experienced bleeding. Blood in the stool requires further investigation. Although it's always a good idea to check with your doctor, it doesn't always mean you have colon cancer. Symptom number 3, bloating. Bloating or swelling in the abdomen is frequently a sign of colon cancer. This is due to a variety of reasons. It could be the result of a tumor that is entirely or partially obstructing the colon, causing a buildup of gas and stool. Bloating may also occur when the tumor obstructs the flow of food and liquids. Additionally, the extra gas may result in stomach pain, akin to colic. Thus, it is best to take care of it. Many factors can cause abdominal pain and bloating, but it's best to consult a doctor if you experience unusual or frequent bloating. Symptom number 4, abrupt weight loss. Now, it's typical if you've lost weight while on a diet. Weight loss is what I mean. You weigh 85 or 83 kilograms presently, while you used to weigh 95 kg. Nothing about what you're eating has changed. You're not exercising more than you used to, and you're not depressed. There are various reasons why colorectal cancer can cause weight loss. One is that, similar to a worm that eats everything, the tumor may change a person's capacity to absorb calories and nutrients. However, the tumor can also release cytokines that can reduce appetite and cause weight loss, like interleukin-1, TNF-alpha, and 6. The tumor might also raise your body's energy requirements, which would lead to both fat and muscle loss. Moreover, the tumor may restrict intestinal passage, resulting in vomiting and nausea. Symptom number 5, constipation. Most people have had constipation at some point in their lives, as it is a common digestive problem. Constipation is characterized by hard, dry stools, infrequent bowel movements, or difficulty passing feces. Dietary and lifestyle changes can often cure constipation, which is often a transient issue. However, if constipation persists over time and accompanies other unsettling symptoms, it warrants attention. Less than 3 bowel movements per week, as well as prolonged experience of these symptoms, are considered chronic constipation. Because the tumor in the colon can hinder the regular movement of stool, colon cancer can result in chronic constipation. As a result, you may have difficulty moving stools and have fewer overall bowel movements. It is crucial to differentiate between occasional and persistent constipation. Food decisions, stress, or other transient conditions can cause periodic constipation. Symptom number 6, diarrhea. Although constipation may be a worrying sign, diarrhea is also something to be aware of, particularly if it persists and is not explained. Frequent, loose and watery stools are the hallmark of diarrhea, which can be brought on by a number of factors such as illnesses, food preferences, or underlying medical disorders. Chronic diarrhea can result from colon cancer when the tumor blocks the stool's natural passage through the colon. When this happens, the body could react by producing more frequent and loose stools, which could lead to diarrhea. It's critical to understand that persistent diarrhea should not be disregarded, since it may result in malnourishment and dehydration. Your quality of life might be greatly impacted and rendered incapacitated by persistent diarrhea. Symptom number 7, pain in the abdomen. Knowing the type of pain and where it comes from can help identify important clues. Colon cancer-related abdominal pain is frequently characterized as cramping, sporadic, or chronic. Sometimes it is associated with bloating and occurs in the lower abdomen. Keep in mind that a variety of illnesses, including but not limited to colon cancer, can cause stomach discomfort, making it a non-specific symptom. Abdominal pain can also result from digestive disorders such as diverticulitis, gastritis, or irritable bowel syndrome, IBS. Abdominal pain linked to colon cancer might occasionally be accompanied by additional symptoms, including blood in the stool, unexplained weight loss, or altered bowel habits. You should visit the doctor immediately if these specific symptom combinations are very serious. Symptom number 8, anemia. When there are insufficient healthy red blood cells in your blood to provide the body's tissues with enough oxygen, it is known as anemia. Numerous factors, including blood disorders, chronic illnesses, and inadequate nutrition, can cause it. Gastrointestinal bleeding is one of the possible reasons for anemia, particularly when colon cancer is present. When the tumor bleeds inside the digestive system, colon cancer can cause anemia. This bleeding, which is frequently undetected, can progressively cause substantial blood loss, which lowers the number of red blood cells and impairs their ability to carry oxygen. The end result is anemia. Anemia can cause a variety of symptoms, but commonly manifests as exhaustion, pale complexion, breathlessness, and cold hands and feet. While anemia may indicate colon cancer, other conditions such as chronic illnesses or nutritional deficiencies can also trigger it. Symptom number 9, rectal bleeding. The term rectal bleeding refers to blood originating from the anus or rectum. After wiping, the blood may appear in the toilet bowl or on the toilet paper. Depending on where the blood comes from and how long it stays in the digestive system, its color can range from bright red to dark red. Rectal bleeding may be associated with conditions such as hemorrhoids, anal fissures, and gastrointestinal bleeding. Hemorrhoids, which are enlarged blood vessels in the rectum or anus, frequently cause rectal bleeding, especially when the blood is bright red. Similarly, rectal bleeding may arise from tiny tears in the anal lining known as anal fissures. Rectal bleeding should raise warning flags, though, if it is severe, ongoing, or accompanied by other worrisome symptoms. It can indicate a more serious problem such as colon cancer. Symptom number 10. Changes in bowel habits. Understanding your bowel patterns is crucial. Some people use the restroom immediately after breakfast, while others use it 2 or 3 times a day, and still others use it twice or 3 times a week. What kind of bowel habits do you have? Keep an eye out for any changes in the way your bowel movements occur. Bowel changes are not always concerning on their own, but be aware that they are prevalent. However, you ought to consult a physician if these changes worsen or persist. Colon habit changes affect about 65% of patients with colon cancer. The location, size, and stage of the tumor can all affect these changes in bowel habits, which can vary from person to person. Understanding the early signs and symptoms of bowel cancer is crucial for timely diagnosis and effective treatment, while exhaustion, blood in the stool, bloating, sudden weight loss, constipation, diarrhea, abdominal pain, anemia, rectal bleeding, and changes in bowel habits are common indicators. They can also signify other health issues. However, it's crucial to promptly consult a healthcare professional when these symptoms persist, worsen, or accompany other concerning signs. Remember, early detection can significantly improve outcomes. Symptom number 11. Discomfort when sitting. A tumor pressing on nearby organs and bones in the colon or rectum may be the cause of this discomfort. It may cause discomfort when sitting for extended periods of time, but it's crucial to understand that this isn't exclusive to bowel cancer. Numerous other factors such as hemorrhoids, enlarged veins surrounding the anus, or just sore muscles from prolonged sitting might also be the cause of this. Remain calm. See a doctor if you're feeling uncomfortable so you may express your concerns and receive a diagnosis. Symptom number 12. Changes in appetite. Although rare, hyperphagia, a condition in which a patient feels more hungry than usual and consumes more food, occurs in certain bowel cancer patients. This may be the result of the body attempting to use energy to make up for nutritional inadequacies brought on by the cancer or the tumor itself. Reduced appetite can also occur. This is more common and is sometimes accompanied by nausea or an uncomfortable feeling of fullness, even after consuming small amounts of food. This may occur because the disease emits chemicals that decrease appetite or because the tumor obstructs the gut, making it harder for food to pass through. And now, we invite you to share your thoughts in the comments. If you like our content, please subscribe to the channel. Thank you for watching. We'll see you in the next one.